Thank you, everybody, for being here today. We know this is a really important bill, and we know how important health care and access to health care is. No one likes to pay more than they have to, especially for health care. That means insurance is necessary for all, but unfortunately not affordable for all. And we all know that no matter how much you plan, it's still very expensive. And no one disputes that it can be very frustrating trying to navigate through different policies, which services or which doctors are covered or not covered. And it's also easy to blame who? The hospitals, the insurance companies, the doctors for the high costs. But the reality of healthcare billing is far more complicated. Both the state and federal government have been working on this issue for decades and have passed legislation to address these cost concerns with commercially insured and self-funded plans. Let's face it, when you're in the middle of an emergency situation, the last thing you want to worry about is what hospital can I go to, how much is my copay going to be, or am I going to get a surprise bill? In some cases, it's inconvenient or impossible to access specific doctors or network services, especially when we're traveling. The ability to access needed healthcare, even for out-of-network providers, is a vital piece of our healthcare system. Negotiated agreements between doctors, hospitals, insurance providers are reflected in the costs of in-network care. So it's not surprising that the out-of-network care would be higher. But I'm concerned that this proposed legislation will create unintended consequences and could actually increase out-of-pocket costs for self-funded or commercially insured residents, or worse, reduce healthcare accessibility in our state. Like my colleagues, I'm concerned about this proposal, and I'm concerned that it might force doctors to either stop treating some patients or close their practices altogether. That's not what we need in the state of Connecticut. But as you can see, rising costs and healthcare access are partisan issues. The goal of this legislation is laudable. Unfortunately, I don't believe this proposal will provide savings the authors intended. I appreciate everybody being here today, and thank you very much.